Controversy in Michigan over vaccinating kids. A new rule says parents must attend a class if they want a waiver for their child. State hopes it will limit the number of kids that go to school unvaccinated.
And joining us now to talk more about this is Dr. Eden Wells, Chief Medical Executive from Michigan Department of Health and Human Services. Good to have you with us.
Thank you.
And also Mary Toka, Research Director for Michigan Opposing Mandatory Vaccines. Dr. Wells, we want to start with you. Why do you think that this new state rule requiring parents to attend a class if they don't want to vaccinate their kids is so important?
First off, I would like to say that it's less a class than more than a counseling time with a public health nurse. This is a way that a parent or the parents can actually sit down with the public health nurse and get a set of information that would be consistent across counties about the risks and benefits of not being vaccinated. Now, that said, this is not to be a negative type event whatsoever. It's a way to really just illustrate some of the events that would happen. For instance, if there is an outbreak at the school and your child is not vaccinated, there would be time that the child would have to spend away from school until the threat of infection is gone. But this is an actual conversation and not meant to be a fight or anything pejorative whatsoever.
So, Mary, the doctor is presenting this as kind of like perhaps a midway point to your opposition to any vaccinations at all. What do you think about it?
Well, first of all, I'm not opposed to what people do. It's their own personal decision, and I think first we have to remember that this is a personal parental decision. So I don't really tell people what to do or what not to do. I believe in making a fully informed decision. But I think there are 3 points that we have to point out. First of all, the waiver form that has been used in Michigan for over 30 years worked very efficiently and effectively. Parents would get the waiver form. And I travel across the country, and especially in Michigan, education and speaking with parents about this topic. And I've never found one parent who wasn't doing research and really looking at this topic seriously who said, I'm not going to vaccinate. And I think when you put a rule across like this, you're basically implying that parents are not making informed decisions. And I think it is subtle coercion that, you know, if you don't vaccinate, you have to come in and sit with us and talk about it because we don't feel that you're making an informed decision. And I think that, you know, people who aren't vaccinating or who are selectively vaccinating are making very good informed decisions and believe that the risk of the vaccination is far greater than the risk of measles, chickenpox, you know, hepatitis B, or even polio for that matter, and are making informed decisions. And one more thing I'd like to add is on the form, parents are being told to sign a form that states that they have been made aware that by signing this form, they are putting their child at risk or possibly other children at risk for these infectious illnesses. And no parent who's made an informed decision should have to sign a form that could be self-incriminating like that.
Dr. Wells, what do you say to that point, that these are educated parents who have already done their own homework and they don't need to do more homework?
Some have, and I would say that Mary, who is speaking with us today, may well be quite informed. But you know, that is a small subset of the people that we work with at the public health or population health level. And so I want to make a point here that's been kind of interesting here in Michigan, that we actually have quite varied rates of waivers to vaccination across counties. I have some counties that have less than 1% waiver rates, and the county right next door might have the highest waiver rate. Why is that? The moms can't be that different from one place to another. And I think that it's not a matter of different moms or such, but the fact that the information is varying across places and the consistent information is varying. So that's not to slight anybody to say, oh, you're not informed or shaking the finger or anything like that, but it is to ensure that our public health nurses across the state can give the same consistent messaging.
Yeah, Mary, it seems like she's saying that informed parents, I believe I understood you to say, is a small subset. So in other words, most parents are not informed? Mary?
I don't know. I didn't hear that from her. I think she was saying that the information varies from county to county. We do know that studies have been done on parents who don't vaccinate, and they found consistently that it was parents who were educated, had at least a 4-year degree, and where the mother was making major decisions, and also had a child in the family who had some sort of vaccine injury. And I will add that a lot of parents are questioning the vaccines now, unlike ever before.
We're having a problem there with Mary's.
If I could take
because we have
you know what,
so
Mary,
much
we're
information at our fingertips, like what are the ingredients that are being injected into our children. And I think parents are really questioning whether or not
Mary, we're going to stop Mary there because your signal is coming in and out, and we are running out of time. But Dr. Wells, if you want to add one more thing.
Just one more thing. I would like to say that it's very true that there are informed folks out there, and I will say that. But we do know that Michigan being one of the, actually the 4th highest state for waivers, that there is a significant number of people we think that can benefit from learning about some of the information who actually say, oh, I actually do want my child to get vaccinated.
Hey, Doctor,
so
I want to
that's all we're
interrupt
trying
you
to change.
one second,
Yes.
Doctor, because Mary did make a point. She said that parents have to sign a piece of paper that says that we are knowingly putting our children at risk.
Yeah.
She apparently objects to that. I mean, is that a fair, valid point? If
You
they're
know,
informed, they're not putting their kids at risk.
Well, I think if they're informed, they may or may not. But one of the things that will happen is then the child enters, if there is a school that they enter where there's an outbreak, that child will have to be removed from the school setting during an outbreak. So that is just simply a way to actually reduce their risk because they're not being vaccinated. They may actually either promote the spread of infection or get the infection that is a vaccine-preventable disease.
Dr. Wells and Mary Tocco, we thank you both for your time this afternoon talking about this very important issue.
Thank you.